rise in coronavirus cases is prompting Brookline to bring back its mask mandate. Starting Monday, face coverings will be required in all town buildings, including public schools. The town says it will lift the order when the current surge is over. And cases are up across Massachusetts. The state's positivity rate is now at 9.5%. That's a level we haven't seen in months. Health officials also reported nearly 4,000 new cases yesterday, and we know that 265 people are in the hospital with COVID-19 as their main diagnosis. In the last week, nearly 15,000 students and more than 4,000 staff members have tested positive for COVID. And joining us live right now is the Chief of Infectious Diseases at Brigham and Women's Hospital, Dr. Daniel Koritzkus. Thank you so much for your time. Thank you for joining us this morning. What is causing the rise in COVID cases right now, and are you concerned?
Well, good morning, Anna. It's a pleasure to be with you. We think that the rise in cases currently, it continues to be due to Omicron, but one of the newer subvariants of Omicron. It's not entirely clear what is causing the rise. Most likely it's because we've had so much relaxation of the safeguards against COVID-19, especially around masking.
And we've been seeing those numbers go up. Do you think that those numbers are actually much higher because home tests are not being reported?
I think it is very likely that the true number of cases is several times higher than what we're seeing as the official numbers, exactly because of home testing, as you say. It's a good thing that people can test at home because then they have a faster way of knowing if they're infected, to seek care if appropriate, and to isolate themselves from others.
And so right now, most Massachusetts counties are currently considered high risk, and the CDC recommends indoor masking in those areas. There have been calls recently to return to COVID protocols, especially in schools and on public transit. What would you recommend right now, especially with this time of year, people are gathering for graduations, proms, and parties?
Well, first and foremost, it's important that people get vaccinated if they haven't, and if they've been vaccinated, to get boosted, and if in the right age group or risk group, to get that second booster. I think at this point would make sense. People can also protect themselves by masking, even if others around them are not, and I would be particularly careful to do so while on public transport or when at large indoor gatherings.
And so looking ahead, do you think that we're going to continue to see a rise in numbers, or do you think the surge is going to end anytime soon?
That is really hard to predict. The wastewater numbers are going up, but they're not going up consistently. And even the daily number of cases is not spiking up as dramatically. We're not seeing doublings every several days. It's creeping up, and so it may be flattening out, but we've learned not to predict things in this epidemic because it's so challenging to know exactly what's going to happen in the future.
That is so true from what we've seen over the last couple of years. Dr. Daniel Koritzkes, thank you so much for your time and your insight this morning. We really appreciate it.
You are very welcome.